Despite containing glandular tissue and producing several hormones including thymosin fraction 5, thymatic humoral factor THF, thymatic factor delta, and thymosin TP1, the thymus is often more closely associated with the immune system than the endocrine system. However, more recent studies have linked the importance of the thymusins, hormone-like peptides produced by the thalamus, with immune system balance, the initiation of the aging process, as well as being potentially diagnostic indicators of autoimmune disorders such as AIDS. The thalamus is a soft, roughly triangular organ located mediasternum or in the superior thoracic cavity posterior to the sternum between the right and left lungs. The thalamus can be divided into two distinct but identical lobes, each surrounded by a fibrous capsule. Each lobe can then be further subdivided into a superficial region called the cortex and an inferior region called the medulla, similar to kidney anatomy. Although the regions are distinctly different, they are made up of similar tissues, being epithelial and lymphatic tissues. If you observe the histology slide, which should be slide 3, you can see a fuzzy pink striated outer layer of connective tissue that makes up the fibrous capsule. Just inferior to the capsule, you can see a darker red stained area, which should be the cortex. This cortex is made of dense lymphatic tissue containing a large amount of lymphocytes. Inferior to the cortex, more towards the center, you can see a light area, a lighter paler pink. This is due to less infiltration by lymphocytes. We're just going to pause briefly and study the thymus histology. On the exterior side, which is primarily cut off on this slide, you're going to have that dense fibrous capsule. If you come down a little bit, that really white section is most likely going to be connective tissue. And then you have your cortex, that red color, as well as that almost medium red to pink color in the middle. That's the medulla. Just remember they're slightly different colored because of the staining, as a result of which one has more lymphocytes in it. You're also going to see these little white infiltrations from the exterior cortex, or from the cortex area inward. These are connective tissue between the different lobes or functional units of the thymus. T-cell development occurs within the thalamus via a process called thymopoiesis. This process describes how thymocytes differentiate into mature T lymphocytes, a type of white blood cell. The histological features that we covered a little bit ago with the cortex and the medulla is going to create a microenvironment that these T cells are capable of proliferating in or maturing. It's very similar to sperm production, where the outside are the least mature, and when you get towards the center, those are going to be your actual cells. They're going to be the T cells in this case instead of sperm. However, this is only possible because of the epithelial reticular cells that make up that outside cortex. This creates a blood-thalamitic barrier, which creates that separate environment. These T cell precursors, called lymphocyte progenitor cells, are able to enter the cortical areas where they interact with the cortical epithelial cells, those reticular cells. They're also called the thymatic stoma, if you will. They go under proliferation or differentiation and into these different cells as they enter closer to the medulla. And they can develop into just general different T cells. So you're going to get CR, CD3, CD4, CD8, and CD2 out of these. The differentiation is primarily triggered by an influx of different hormones, which we will cover shortly. Only about 3% of the cells that enter the thymus will mature into naive T cells. The majority will die via apoptosis, a pre-programmed death of thymocytes, causing the shrinkage and condensation of the cell and nuclei. Apoptosis is triggered by the influx of glucocorticoid hormones released by the adrenal gland and during puberty. This contributes to the atrophy of the thymus later in adulthood because the cells are generally deteriorating or undergoing atrophy. T cell development is greatest prenatally and then before puberty when the thymus reaches a maximum weight of 1 ounce. It's kind of your peak puberty. And then you're going to have that influx of glucocorticoid hormones, which is going to slowly shrink the size of the thalamus. This process is called thalamic involution, or just generally atrophy of the thalamus. The cells are generally replaced by fat, and this decreases your T cell production later in adulthood, and your immune system is basically suppressed or less than it would have been during early adolescence. This particular slide examines the composition of the thalamus from newborn to 7-year-old. As you can tell right off the bat, there's very different color combinations. The pink and white are in different ratios when you advance through the years. This is primarily due to just general composition as well as replacement of the thalamic tissue with adipose tissue, just associated with thalamic involution or atrophy. The thalamus is being replaced, so it's not as functional anymore. In the newborn, you have a lot of that really pink. It's closely crowded lobules of thalamic tissue. You're also going to have a large amount of hasel, which are bodies of epithelial cells that form in the medulla. As you progress past that really dense pack of thymocytes into the 10-year range, you're going to start getting the perivascular space to be slightly larger, and it looks like there's almost holes cut out of the cortex in the medulla. At about the age of 21, that's when you start getting that perivascular space is starting to be replaced by adipose tissue or fat tissue. That is going to progress through the rest of your life. That's why at 7, it is primarily white in that adipose. The adipose tissue is the white identification there, and that perivascular space is primarily all white, which it makes a lot of sense why you wouldn't have as great of an immune system at that point, because there's not as much of the thalamic tissue to actually develop or to raise these T cells. The thalamus plays a critical role in the immune response. Not only is it the site where lymphocytes are developed prenatally, it is also responsible for releasing hormones that enable lymphocytes to develop into mature T cells. The particular hormones involved will be covered in the next slide. This particular chart, titled Thymic Hormone Properties in Purified Peptides, has a list of the different thymic hormones on the far left, as well as their biological functions if we currently know them. I'm going to focus just on 2 of the thymic hormones, and it's because of this well-established link within the endocrine system. The first one is the thymosin faction 5. That induces T cell differentiation within the thymus itself and also increases immunological function, just because of the increase of T cells for your immune system. In addition, faction 5 also increases the release of ACTH by the anterior pituitary gland. That's usually due to biological stress, and then that in turn, the ACTH, will influence the adrenal gland to produce cortisol, which increases blood glucose volumes. The other one that we're going to just examine that faction 5 increases the release of is a glucocorticoid, and that is steroid hormone. It's directly linked to nutrient metabolism and the catabolism of protein, breakdown of fats, as well as the synthesis of glucose. So that is the first one, faction 5. As you can see, it's definitely getting into the bloodstream and influencing these different positive and negative feedback loops for different endocrine systems. The other one is TS. It's on the very bottom. It induces markers and specific function of T lymphocytes, both in immunosuppressed and immunodeficient people. There is a possibility that this could that this particular hormone could act in lieu of the thymus as it starts to deteriorate with age, or possibly be an influence of some of those immunocompromised people, but it may actually do part of what we consider the entire gland to do within them. within the different immune systems. So that is a possibility or a marker potentially for AIDS research. The dysfunction of the thymus is generally associated with impaired immune response and an increased susceptibility to infection. That can be, in many cases, it could have went through too much atrophy, it could have died, it could have been removed. The more common, and they're not common, they're quite rare, but the more common ones for the thymus to have dysfunction in is congenital disorders. There is a gene mutation that makes it so you can't develop T cells properly, and that's going to compromise a child's immune system and have them more prone to infections as well as SIDS. The other one that we probably have is a second congenital one. It's called DeJour syndrome. You can see the little child on this particular side with the cleft lip. That is one of the particular manifestations of DeJour syndrome. It is a missing piece of the 22nd chromosome. The thymus doesn't develop properly. It also influences other things like it gives you head defects, cleft palates, low blood calcium levels, and possibly a delay in behavioral and emotional development, which could lead to some issues there. In general, for our purpose with the thalamus, it also decreases your immune response so that you have a weakened immune system and you're not able to fight off infections if you happen to get any.